Are you trying to understand what the source of your spinal pain might be? Well, it might be helpful to take a deep dive on the anatomy of the spine to get a better understanding of what could be contributing to your pain. My name is Dr. Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley, and for many years I taught anatomy to yoga teachers. And so I really enjoy talking about the anatomy of the spine in particular. So why don't we talk about the different structures so you can have a better understanding of what might be causing your pain. So the spine itself has a number of curves. So here's the skull, and then we have our neck curve. We call this a lordosis, and then our upper back curve, which is a kyphosis, and then we go back again to a lordosis before we hit the pelvis and the sacrum, where it again becomes kyphotic. Now, interestingly, when we're children, our coccyx, our tailbone, is not quite fused together, but as we age, it starts to fuse, and so does the sacrum. The sacroiliac joint is the joint formed between the sacrum and the pelvis. There's a very small amount of movement there, but sometimes when patients come in and they say, oh, my hips feel misaligned, or I've got one leg longer than the other, I'm walking funny, it's often a dysfunction either at the sacroiliac joint or at the very bottom joint, the L5. Now, another interesting thing about the spine is the little joints that are made. So each bone stacks on top of the next, and they make a joint called a facet joint or a zygoapophyseal joint. And these joints allow us to move, but depending on where we are in the spine, there's more movement or less. So the neat thing about the neck is that the joints are on a 45-degree angle. So that really gives us a lot of options. We can rotate, we can look up, we can look down, we can go sideways. But when we get into the thoracic spine, then the joints are more kind of straight up and down. And the other limitation that we have in our middle back is our ribs. So our ribs attach at our sternum, they wrap around and they actually make attachments into the vertebrae themselves. So you can imagine those ribs, it makes it harder for us to side bend. It also creates a bit more of a stiff movement in flexion and extension. Rotation is actually where we have the most movement in our thoracic spine, if we're not taking into consideration all our tech use, our driving, all that, because it is a common area for us to get quite stiff. As we go down into the lower back, the angle of the joints change again. So we've gone from 45 degrees to more of a 90 degrees, and then they flip. So now we're going sort of side to side. So the low back is really good at bending forward and extending, but less mobile in rotation, and that's normal. Now, where there's often problems is these transition points. So from the neck to the upper back, from the upper back to the low back, and then from the low back to the sacrum. Because in all those areas, the angle of the joint is changing, particularly that L5, S1, the low back to the sacrum. It goes from side to side to up and down. And the neck, it's a little more gradual when we go from neck to thoracic spine, but of course the angle of the whole spine, the curve itself, is changing. So often we see strain in that area, also again because of our lifestyle. And then in the upper back to low back too, same thing. Then of course there are the discs. So there's intervertebral discs in between all of the vertebrae. These discs act as shock absorbers. They are filled with a little bit of a jelly donut center, and on the outside is like a fibrous ring. So when you hear of a disc herniation, a disc bulge, a slip disc, what has happened is the disc itself is either being squished and squeezing out, or there's like little tears in the disc itself, that outer ring, and the jelly donut surface has kind of squished out, and that can be really painful. So it can be painful for a number of reasons. The disc itself can come in contact with the nerves, which exit right near the disc, or the jelly donut center has a chemical reaction with the nerves. So that's why it can be so painful. The most common areas for disc bulges are L4-5, L5-S1, but also in the neck, the C4-5 area. Not as common in the thoracic spine, although it does happen. I mentioned the nerves. So we have our brain, and then we have our spinal cord. And the spinal cord is protected by our vertebrae. So we don't have a good view of it here, but we have the vertebral body, and then there's an opening and that spinal cord runs through, and then we have the spinous process at the back. So the spinous process is the part of our spine we can feel, but in between that and that big thick body part runs our spinal cord, and then off the spinal cord are all the nerves that go out to our arms, our legs, our organs, our skin. And so when we have problems, let's say they're getting a little bit pinched by the joint itself, or you have a bony buildup of arthritis, there's less room for the nerve. That's why you might have a problem in your arm, for instance. So if you have less room for the nerve coming out of the neck, then that's going to cause like a numbness and a tingling or a pain and irritation, sometimes even an itchiness, some kind of nerve sensation that's not in your neck, it's in the nerve exiting the neck. So the spine is really complex, really complicated, but luckily we have tools and treatments that we can use to help you if you are in pain. If you'd like to book online with us, you can book at willowbrookchiropractic.com. We post regular content under Willowbrook Chiropractic on YouTube, Facebook, and Instagram. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.